Today we will guide you through the swabbing technique to obtain COVID samples for analysis. COVID-19 is an infectious disease caused by a virus of the coronavirus family. The early identification and isolation of patients with the disease and the distancing of those that are healthy but at risk is a critical element in the containment of the disease. The objective of this video is to give an insight into the process of selecting the right equipment, applying the right technique, and an overview to the processes involved in the handling and delivery of samples. To begin, collect the required kit from pathology specimen reception located on the first floor. This includes a white biohazard bag, a transparent resealable bag, a blue capped tube, and a swab. You will also need personal protective equipment or PPE, a regular pathology specimen bag, and 2 copies of the request form. In most cases, regular PPE, including a surgical mask, apron, and gloves, is enough. Only for those patients with aerosolization of the virus, further protection is needed. If in doubt, ask for senior advice. Label the container with a patient addressograph. This is a critical step, and many samples have been rejected due to poor labelling. Wash your hands thoroughly and put on PPE. Take the swab, the container, the specimen bag and the sample bag next to the patient. Explain the procedure to the patient and gain consent. Ask the patient to lean their head back and open their mouth wide. Swab each side of the back of the throat. And then swab each nostril using the same swab, applying just a bit of pressure. Once that's done, open the sample container and put the swab in it, snap the swab, and close the container. The container has a liquid for sample analysis. Do not get rid of this medium and make sure that the collection tube is closed tightly and properly. Place the tube in the pathology specimen bag and then the resealable bag and close. Place the bag and one of the copies of the request inside the white bag and close. Remove all PPE and clean your hands. Stick the request form on the front of the white bag. Call the porters or carry the bag to pathology reception for further processing. Please note, if you are doing rapid flu testing, the test can be done on the sample sent for COVID-19 testing. Order both at the same time on ice. The label for the rapid flu test should be included in the white bag to ensure that the order is not missed. Be aware of the most common mistakes. And remember, stay safe.